Welcome back, everyone. Today, we are diving into one of those foundational principles that sounds like it belongs in a dusty old library, but actually shows up in the ER every single day. We're talking about Hilton's Law. Dr. Sarah, how do we explain this simply to a student who just saw it on their syllabus and panicked?
It is actually quite elegant once you strip away the jargon. Hilton's law states that the nerve that supplies a joint also supplies the muscles that move that joint and the skin covering the distal attachments of those muscles. Essentially, the body uses a single wire system for a specific functional unit.
I love that. It's a 3-for-1 special. Think of it like a smart home system. If you have a room, the same circuit breaker controls the lights, the heater, and the motion sensor. It's efficient. But why does this matter clinically? Why did the body evolve to wire us this way?
From an academic and evolutionary standpoint, it is all about the protective reflex. If a joint is injured or inflamed, the sensory fibers in the joint capsules send a distress signal. Because that same nerve also supplies the muscles around the joint, it triggers a protective spasm. It splints the joint to prevent further movement and damage. On the boards, they love asking about these neuromuscular relationships.
Exactly. If you've ever seen someone with a severely inflamed hip or knee, they walk with this rigid, guarded gait. That's Hilton's Law in action. Their brain is basically saying, hey, the joint says we're in trouble, so I'm going to tell the muscles to lock everything down. It's the body's natural cast.
And we can't forget the third part of the law, the skin. The nerve supplying the joint also provides sensory innervation to the skin overlying the insertions of those muscles. For a board exam, you need to understand that this is why we see referred pain. Pain from a deep structure like a joint often presents as a sensation on the skin.
This is where students get tripped up in the clinic. Let's talk about the hip-knee connection. I remember back when I was the doctor of choice for a local high school football team, I had a kid come in complaining of intense knee pain after a fall. We looked at the knee, it was totally fine. No swelling, no ligament laxity. Dr. Sarah, what was actually happening?
That is the classic Hilton's Law trap. The obturator nerve is the culprit there. It sends articular branches to both the hip joint and the knee joint. Because of this shared innervation, a pathology in the hip, like an adolescent with a slipped capital femoral epiphysis, can actually manifest as pain that the patient feels only in their knee. If you don't know Hilton's Law, you'll spend all day imaging the wrong joint.
And that is why I always tell my residents, if the knee looks good but the patient is limping, look at the hip. You have to respect the wiring. It's the same reason why someone having a myocardial infarction, which our textbook mentions, feels pain in their left arm or jaw. While that's visceral referred pain, Hilton's Law is the somatic version of that same confused signaling.
Precision is key here. For the USMLE or any anatomy board, remember the 3 components: joint, muscle, and skin. They might give you a scenario where a patient has a joint infection and ask why the surrounding muscles are hypertonic. The answer is the shared nerve supply. It's also important to note that this isn't just about pain, it's about proprioception. The brain needs to know where the joint is in space to tell the muscles how much to contract.
Right, it's a feedback loop. If the joint is stretched too far, the muscles get the memo instantly because they share the same internet cable, so to speak. Now, does Hilton's Law apply everywhere? Are there exceptions?
It is more of a strong guideline than an absolute physical law, but for the purposes of clinical anatomy, it holds up remarkably well in the limbs. The main thing to remember is that most joints are supplied by multiple nerves. For example, the knee is supplied by branches of the femoral, sciatic, and obturator nerves. So Hilton's Law applies to each of those nerves individually.
So if the femoral nerve is involved, it's looking after its specific portion of the joint, its specific muscles like the quadriceps, and the skin on the anterior thigh. It's like a neighborhood watch program. Everyone has their specific street to cover.
Exactly. And clinically, this also helps us with regional anesthesia. If we want to numb a joint for surgery, we have to block the nerves that supply the muscles and skin in that area too. You can't really isolate one without affecting the others because they are bundled together.
I find that so fascinating. It brings us back to the why. If we didn't have Hilton's Law, our reactions would be too slow. If the joint felt pain but had to send a signal to the brain, wait for the brain to figure out which muscle to move, and then send a signal back down a different nerve, we'd be falling apart. This shared wiring allows for a localized, rapid-fire response.
It truly is about efficiency. To summarize for those taking notes, Hilton's Law links the joint, the muscles moving it, and the skin over those muscles. High-yield points, expect questions on referred pain, especially hip pathology presenting as knee pain via the obturator nerve, and the mechanism of protective muscle spasms.
Perfect. So the big takeaway, don't just look at where it hurts, understand the wiring behind it. If you know the nerve, you know the joint, the muscle, and the skin. Thanks for joining us for this deep dive into Hilton's Law. We'll see you in the next session.